Okay, Sheriff, I've made you co-host for now. If I just promoted Carl, if you see anyone on the attendee list that shouldn't be, that should be on the panelist, let me know, and I can promote them.
Great, thanks a lot. Thanks a lot. I see that Carl is here. Hi, Carl. Please, can you speak to hear if your audio is okay and the video as well? You can turn on your video.
Hi. Yes, sure. Hello, good evening, everyone.
Great. Thanks a lot, Carl.
Can you hear me? But I can
Yes.
open my scam. It says that, yeah.
Yeah,
All
I
right.
changed the setting. That's good. You can all open your videos now if you want.
Okay.
Great. So, Carl, the floor is yours, and all the panelists, you can also turn on your cameras while speaking, and let's go.
All right. Thank you, Shira. Hello, everyone. Good evening, good morning, and good afternoon. Hello to our panelists for today's webinar. So, welcome to our webinar. I'm Carl Angelo. I'll be your host for today's webinar. On behalf of ayKP Partnership, thank you so much for joining with us today for our knowledge sharing webinar series on monitoring and evaluation. We are so excited to join experts in HIV monitoring and evaluation to learn about the most exciting developments in data for adolescent and young people population. So whenever you are right now, just sit back and relax as we listen to them. Take down your question and feel free to use our question and answer Q&A function below. So today we are with Luis Garcia Espinal from Elton John Foundation. We have Vicentius Asbian, M&E Officer from Intimuda, Indonesia. We also have Dr. Greg Rosen from John Hopkins School of Public Health and Marion Thorne from UNE. So here we go without further ado. Let's call Vicentius Asbian, who is our Research Advocacy and Program Officer at Intimuda, Indonesia. Our first question is, what are some of the Intimuda's key principles when conducting M&E to protect young key population states?
Thank you so much, Carl, and everyone. Can you hear my voice clearly?
Yes.
Okay. Thank you so much, Mara. My name is Vincentius Asvian. You all may please just call me Asvian, and I'm from Intimuda, Indonesia, Young Key Population Network in Indonesia. I have a brief presentation, only consists of 2 slides. Am I be able to share my screen? Okay, thank you. So, thank you, everyone. Thank you, the team for this webinar. Again, I'm from Intimuda, Indonesia. It's abbreviation for Instructive Network to create involvement of young key population in Indonesia. Intimuda Indonesia is an organization of young people who is working in this 5 scope of work: and advocacy, research, campaign, networking, and organizational strengthening in the HIV issues, specifically to the young people under 30 years old. We are currently covered in 10 provinces in Indonesia. And when I got invited to this webinar and got the questions regarding these, what are some key of Intimuda's principles when conducting M&E to protect young key population data. So everyone, for the background, I'm working as a research and advocacy officer. The community-led monitoring research is a project or program to do research on the HIV access among young key populations in Indonesia. So when it comes to monitoring and evaluation, it got me thinking about those monitoring to the healthcare facilities, to the project, to the program, to the data, and then to the Intimuda Indonesia's is ourselves project or data. So when it comes to those aspects, we use the M&E tools or measurement such as logical framework, timesheets, evaluation form, pre-post test, and then activity report, annual and quarterly report, and then etc. And then for the area of this, the utilization of this tools or measurement is on the project and then activities, monthly work progress, and annual and quarterly work progress. So when it comes to the principles on or doing this M&E M&E project or program is, I think I want to highlight on these two aspects. The first is we need to consider participations, flexibility, and inclusion to all. What is this, those things? So what I mean with this participation, flexibility, and inclusion is sometimes monitoring and evaluation tools is not really friendly to young people. Sometimes young people in in a broad geographical context, in a different background, they are not be able to access a lot of things, such as for example the forum, the tools, etc. So I think when it comes to M&E monitoring evaluation, we need to highlight on how young people be able to participate at the first place, and then the flexibility of the tools, and also the inclusion to all, which means to all people from the background. And secondly, that I want to highlight is data segregation. When it comes to young people, the thing that is special, that is important that we need to highlight is how this data, how young people data be able to segregate to divide the data from several indicators, such as the first thing is age, and then key populations, and then gender, and then geographic background. Why is this need to do? Because when it comes to a monitoring and evaluation data, when we want to monitor and evaluate the effectiveness of a program or on the activity, we need to see whether it's applicable, whether it's effective to all background, whether it's effective to all gender, to all key population, and the ages as well, and as well in the geographical background. I think when the biggest tools that we use in Inti Muda Indonesia to do this M&E is, you can see the screen. It's really small, but I hope you can see it. This is the logical framework. We develop this every 4 years. So this is the activity, the objective, and the goal, the outcome, and the goals. So in conducting the activities, it is important to always highlight these two aspects: participation, inclusion, flexibility, and the last thing is age, and the other aspect, the segregation. That is a really short and brief presentation from me. I hope I can deliver the message clearly. Thank you so much, Luis. Thank you so much. Sorry, thank you so much, Carl, and the other.
Yeah, thank you so much, Vicentius, for this very quick but very informative insight in terms of safeguarding the data of our Yankee population. It is really important to safeguard Yankee population's data as we continue to provide opportunities to this age bracket. So we'll go back later. Now we will go to Luis Garcia Espinal, who is the Senior Monitoring and Evaluation and Learning MEL Manager at the Elton John AIDS Foundation. So our question to you, how do you support your grantees, knowing that Elton John provides grants in monitoring and HIV program success, particularly for adolescent and young key populations? And what advice would you give to youth-led organizations working in this field? Over to you, Luis.
Great. Thanks a lot, Carl. And well, first and foremost, just to say that I'm very proud and I'm glad to be part of the session with these fellow speakers. So thanks for giving me the chance to participate. So well, to address your question, Carl, I guess that first I would like to remark a couple of things before addressing this question. So first, I guess that it's important to understand the operational capacity of our grantees, right? As a donor, we work directly with them in partnership. To say, in a way, grantees, they comes in different shapes and sizes. So it can be from large and long-standing organizations on the ground to more small community-based organizations. So this remark speaks directly to their resources, right? Secondly, I would like to briefly mention about the MEL, the M&E, the meal culture, including accountability, of course. So it's not uncommon to find that disregarding of the size of the organization or the operational capacity, MEL monitoring and evaluation is still not an integral part of their program implementation cycle. So against this background, it's important to consider, based on these two aspects, the MEL team at EGF, at the Elton John Foundation, we engaged in conversations with the grantees from very early stages, from the application stage, where we try to, let's say, distill one, what are the relevant areas for both the grantee and EGF to generate insights from, and what capacities are needed in order to deliver, right, these evaluative or monitoring endeavors. Other factors are indeed the nature of the program, the phase of the program. So let's say a program that is on pilot versus a program that is on scale-up phase, and the duration of the program. In essence, I think that myself and the team are proud to keep that very close and collaborative synergies with our grantees to craft the monitoring and evaluation plan. So now, a main challenge that probably my fellow speakers will probably agree with is related to obtaining data from adolescent population. And this affects clearly to younger than 18 population. It has, as you may guess, legal and ethical implications. And these challenges are more profound depending on how sensitive is the topic that we try to uncover. And well, we are in HIV programming. We know that there's stigma ramping in, unfortunately, in the geographies that we tend to focus. So this is something to consider. Of course, the key priority here in any monitoring or evaluation system covering adolescent population is the no harm principle, right? So these challenges will vary from program to program, and I dare to say from country to country, but generally getting data from younger than 18, it's very difficult. So it may affect less to the monitoring efforts than evaluative, but still is a challenge. So, well, to continue, these challenges are considered when building up the monitoring system at the early stages of the proposal. And this process for us, so it may take few weeks of conversations where the grantees and EGF, we collaborate in selecting a bespoke or fit for purpose set of KPIs that can be used to keep track the progress of the program. And normally is on a quarterly basis, right? And of course, this set of KPIs is including or reflecting the HIV treatment cascade. For the evaluation plan, which is something different than the monitoring, it's developed, or we tend to develop it once the grants agreement has been formalized, and it takes again a very collaboratively approach where the grantee will reflect their learning agenda, and EGF will try also to add our learning agenda to their efforts. One of the key aspects here in this stage is to understand what is the very goal of the program, either if it's integration, if it's policy change, if it's scale up. These would definitely help to identify the key audience towards we should craft a powerful message charged with insights. And it seems simple, right? But it's often an intricate process to figure out the right audience. So an example of this is certainly that a proof of work type of evaluation would not be sufficient for objectives such as integration or policy change. So throughout this process of considering what is the right evaluation plan, we learn what are the capacity gaps, and depending on them, there are some solutions, right? So it might be internal support or capacity building. We can externalize the evaluation and monitoring system, or we can bring a third organizations to help support their capacities. Normally, grantees would need some sort of like internal capacity building, supported by maybe some external consultants helping on doing, for example, data collection or analysis. Whatever are these solutions, and just to summarize this first question, the monitoring and evaluation plans are designed in a collaborative, nimble, and participatory manner, adolescent sensitive, of course, and bringing adolescents' feedback into our M&E system. Now to your question, I'm probably here to be very direct. I think that I have just 2 tips. First and foremost, it's important to understand the value of M&E. So at times it seems that for some organization is a luxury to be within their team, but it's actually crucial for their activity, and precisely, I would say, for small scale organizations, as they would need to show what they are doing in a rigorous manner, right? But not only that, also M&E culture will help them to understand what is best for the clients or for the beneficiaries. So first tip is to acknowledge and to embrace the value of M&E. We can commonly think of the traditional program cycle phases. So there is a tendency out there to get M&E out of these different stages, which comes, of course, with high prices, right? Which is lack of accountability, lack of clarity on results, inability to practice adaptive management, and these are among many other costs, right, of not including M&E in the program cycle. The second tip is that at the back of nurturing M&E culture, M&E capacities needs to be developed. So it is crucial to learn what are those areas, as well as identifying what are the resources or budget that is necessary to cover those gaps. So many donors or funding organizations, as EGF, we can provide certainly some support on identifying those gaps and implementing capacity building sessions arising from the needs of those very particular program. But it's key for the organizations to invest on M&E skills and staff to close the gap and to be in a good position to show the learnings and successes of youth-led organizations. So I guess that with this, I hope that I addressed correctly your questions, Carl.
Yes, Luis, absolutely. Thank you, Luis. That is fantastic work, and it really, we really need not to have a skill on M&E as we move forward on not only on the HIV program, but even in ASRH with other program for adolescent and young people, because it will become the backbone of every project, programs and activities that we are going to implement. So with that, thank you so much, Luis. We will now go to Dr. Greg Brusen, who is an assistant scientist at the Johns Hopkins School of Public Health. Dr. Greg, are you there?
Yes,
So
I'm
what
here.
Yeah, thank you, Doc. So our question is, what are some of the emerging innovations that youth-led organizations could take advantage of to support both monitoring of their programs, but also ensuring that investment in adolescent and young key populations are made as they should be?
Yes, well, thank you again, Carl, and good morning, good afternoon, good evening to everyone. It's a real pleasure to be here, especially amongst so many implementing partners that are directly close to the work. So I've been asked to speak about some innovations in monitoring and evaluation that can be used to optimize the way services are delivered, but also to ensure that investments are sustained for adolescent and young key populations programs. So before maybe directly answering the question, I'd like to provide a bit of context about me and about the type of work that I'm engaged in. So I broadly identify as an implementation scientist. So my work is less focused on generating new evidence around products or technologies that may improve health outcomes, but more so how do we take the existing strategies and services that are in practice that are evidence-based, and how do we make them better for both clients of those services as well as the implementers themselves. So that is really the space that I occupy, and I focus predominantly on HIV and harm reduction services. So that intersects very broadly with adolescents and young key populations globally. A lot of the work that I do is mostly concentrated in East and Southern Africa, though more recently I've had the privilege of doing some work in collaboration with UNICEF colleagues in Cameroon, Cote d'Ivoire, and Nigeria, which is some of the work that I'll be talking about here as an example of innovative methods. So really what implementation science focuses on is closing the no-do gap. So we know, for instance, that PrEP is an effective technology to reduce the risk of HIV acquisition via sexual transmission. In reality, PrEP uptake has been very low in a lot of contexts, and it hasn't reached the populations who are sometimes most at risk for a number of reasons. And so we have to think about how we can optimize strategies to deliver PrEP differently. So that is really where the area of the no-do gap is important for implementation science, is how do we get things that are evidence-based and close that gap? So what I'm going to spend a lot of my time talking about is this approach of latent variable modeling. So the original application of some of these tools is really to think about how do we take data that we observe and measure. So this could be information on individual sexual partners, the number of condoms distributed. So different types of things that we are collecting either in surveys as part of our routine data collection, clinic data collection. These are all observed things that we might measure. The reality is sometimes those things that we observe can help us signal to understand things that are unobservable in reality. So my colleague spoke earlier extensively about stigma. And in reality, stigma is an example of a latent variable because it's not something that we can directly observe always. There isn't, for instance, a blood test that tells you how much stigma someone has experienced. The reality is that we have to arrive and measure some of these more latent constructs by asking individuals questions about experiences and perspectives that help us understand a multidimensional complex construct like stigma. So these are a suite of methods that really derive, I think, a lot from the mental health services and psychiatric service literature. If we think about something, a mental health condition, for instance, like depression or anxiety, it's not something that we can directly measure through a blood test or urine testing. It's something that we have to ask about. We have to directly ask and measure symptoms of those conditions in order to understand whether somebody meets criteria to be diagnosed with such conditions. So in a lot of ways, the traditional application of these latent variable modeling methods have been used, for diagnostic purposes, to develop risk stratification tools, but they can be particularly effective at thinking about how we segment our services. So in the context of monitoring and evaluation for adolescent and young key populations, these are really potentially powerful tools to help us think about how do we understand the clients that are receiving our services, are enrolled in our programs, are being reached by different services that our programs are offering, and do those actually align with the types of persons we are trying to reach? So it's a really helpful check to really demonstrate, can we achieve high coverage of our services and high penetration of our services in the types of people that would benefit most from them? So maybe to help concretize and make this a little bit of a less abstract conversation, I'd like to walk us through a very specific example that I undertook with colleagues in UNICEF in Cameroon and Cote d'Ivoire. So what we see here are essentially different profiles of sexual relationships that we identified using one of these latent variable modeling approaches called latent class analysis. And so without getting into the details of what that method actually is, we essentially take observed variables, which here are different items about a sexual partner. So here it's, is it a cohabiting partner? Was there an exchange of sex for money? Does the individual anticipate that they will have sex with this partner again? Does the individual know the partner's HIV status? Were condoms used at the last sexual encounter? And is there an age disparity between the individual and the partner? So this data, I would say uniquely, maybe to segment this from what we would like to be talking about today, this is an application that was done using survey data. But one can imagine that we could do this easily with intake forms, for example, or screening forms for a drop-in center or for a clinical service. So what I'm going to be talking about here is taken from publicly available survey data, but can also be used with routine M&E data as well that organizations are collecting in this space. So what we did is we used latent class analysis to essentially identify, are there discrete risk profiles among sexually active adolescent girls and young women in Cameroon and Cote d'Ivoire? And we identified 4 different types of partners that adolescent girls and young women were reporting, and they're described below here into these 4 different profiles. So the first are cohabiting age disparate partners. The second are non-cohabiting similar age partners. The third are one-off age disparate partners. And then the last one we characterized as non-cohabiting but permanent age disparate partners. So essentially what we see here is really a heterogeneity or a lot of variation in the types of sexual partners that adolescent girls and young women report, basically to counter assumptions that a majority of adolescent girls and young women in these contexts report maybe 1 or 2 different kinds of partnerships in their life. The reality is we see a much more heterogeneous picture of partnerships and potentially HIV risk emerge. So from this, we actually looked at an outcome of HIV infection, which was measured using rapid blood testing in the field and confirmatory testing in a laboratory, and found that adolescent girls and young women reporting a type 3 partnership, which here is the one-off age disparate partners, were over twice as likely to be living with HIV compared to women reporting a cohabiting age disparate partner, and close to 8 times more likely to be living with HIV compared to women reporting non-cohabiting similar age partners. So essentially what this application led us to believe, or led us to conclude, is that depending on the types of partnerships adolescent girls and young women exhibit, their risk for HIV infection was different. And that difference required segmented interventions. So this was a way of saying, for women that are being screened in programs or being reached by different prevention programming, having tools that let you try to stratify individuals by these different types of criteria lets you understand maybe women you want to prioritize for PrEP or HIV self-testing or other types of testing, to understand whether they need more intensive prevention interventions or whether they need to be facilitated into the HIV care continuum. So maybe to close out here, I would say that one sort of methodology that we can use, we can learn from these suite of tools and methods to think about ways of not just segmenting populations that are being reached by services and programs, but really to answer the question, are the types of persons that we're reaching with these services appropriate for those populations? So instead of an outcome like HIV infection, one could imagine looking at enrollment in a PrEP program or initiation of PrEP or dispensation of HIV self-testing. Are those services actually being offered and adopted by the persons that we are trying to reach or that we know exhibit elevated HIV risk? So that really concludes what I was formally presenting. Thank you again for the opportunity to share some of the insights of this work, and I look forward to more conversation.
Thank you so much, Dr. Greg, for picturing out how important MNT in our works. At the same time, as a glimpse of, as we provide this webinar to all youth organizations that are joining with us tonight. Thank you, Dr. Jason. So last but not the least, I would like to introduce Marion Thorne of UNAIDS to discuss on how UN agencies integrate youth and young key populations in their program planning and report. Over to you, Marion.
Hi everyone. Thank you, Carl, and thank you everyone for having me. It is quite a tough call to go after such panelists. Can you see my screen? Yes, all good. Okay, so I'm Marion Thorne. I'm a planning and reporting officer in the UNAIDS Secretariat. And I will briefly give you a little general and quite high-level overview of how the joint program collects and reports its results, and more particularly its results on young people. So first, I wanted to give you some of the context for maybe some of us that are less familiar with UNAIDS. So UNAIDS is short for the Joint United Nations Program on HIV/AIDS. So it is composed of 11 UN agencies, including WHO, UNICEF, UNFPA, and others, and of the UNAIDS Secretariat. This means that our planning and reporting processes can be quite complex, as you can imagine, and my role with my team is to consolidate the inputs from the 12 different agencies, different entities at different levels, and to be able to showcase our results in driving the overall HIV response, but also without overwhelming our donors and partners with too much data. So our reporting exercises are done against the UNAIDS results framework. Currently, this is the 2022-2026 UBRAF, which has 3 outcomes and 10 result areas. So one important element for us here is the result area 7 on young people, for instance, or the one result area 4 on community-led HIV response, which were both actually introduced in this 2022-2026 UBRAF. So every year, to give you a general idea, we are asking our teams at global, regional, and country level to report against this framework, in particularly against the 3 outcomes and the 10 result areas, using an internal web-based tool. And I think this is important because the way we're doing the reporting per result areas and not by activity, which would have been impossible anyway, given the volume of activities. But this way of reporting allows us to regroup the performance data on specific areas of work and allows me, for instance, to extract all performance data on a specific area of work. So if you're asking me to extract all the data we have on young people, all the performance data of UNAIDS, I can extract it right away. So the data that is collected and used will be used to develop a set of reports, the performance monitoring reports, which are submitted to UNAIDS board every June. So you can see here on the slide the 4 covers of the documents that we produced last year. And I would recommend you to have a look in particular at this one, the results report, because this is where you will find specific sections on the results against specific result areas, for instance, result area 7 on young people. And you can access all our results and all our reports and other materials here on the UNAIDS Result and Transparency Portal. You have the link here, and I will recommend you, of course, to have a look now, but also having a look in a few weeks because we are redesigning it. So we're going to launch a new one in end of May, I think. So beside the narrative reports, we're also collecting performance indicator data. So each country team will answer several questions. And here, for example, you have the 2 indicators that we have on young people. So the first one is on the number of countries that the joint program supported to increase access to youth-friendly sexual and reproductive health. And the second one on the number of countries supported to develop and implement costed plans to expand and institutionalize youth-led HIV responses. So you can see that we are providing every year to the board the latest progress. So here the number of countries, the milestone, the target that we are aiming for. You can see, for example, also more information, more disaggregated information that we can collect as well through indicators. So for example, here we have the 26 countries that we supported to develop the plans, but as well you can have more information on exactly what type of support the joint program provided. So for example, policy guidance in 20 countries, or technical support in 26, or financial support in 17 countries. So these progress indicators are very important because they allow us to collect the joint program's performance in a systematic way, comparison to the narrative reports. And they allow to compare the results over the years, and we can better show the impact that we have over time. And I said impact, but the truth is that we're only talking about output results here. So they are only the direct contributions of the joint program. And this is a challenge that we have in our reports, because how can we link our output results to actually the outcomes that we're aiming to achieve? And this is where the GAM data, the Global AIDS Monitoring data, I think you are mostly familiar with it, like incidence, prevalence, level of stigma. This is something that we are collecting with the national counterparts. So these are available on AIDS Info. And we are using the GAM data to complement our performance reports because they are helping us in linking our output results to the changes we see in the overall HIV epidemic. So it's important here, of course, to be realistic. So we cannot say that the UNAIDS decreased the HIV incidence in this country X over this period of time, but we can say that we contributed to this decrease by doing A, B, and C. And this is what we are trying to change the framing and making sure that we have the correct wording as well in our reports. And one other element here is that we have 2 indicators here on young people, but we also have other indicators on HIV prevention, treatment, gender equality, human rights, etc. And most of them are actually not disaggregated by type of population or by age. So this is the limit of our performance data. The simplicity of our framework is very helpful, of course, for our reporting, but it also ends up lacking a little bit in specificity of the data. And this is a consequence from having such a complex organization, such a complex program. But we constantly try to reduce the reporting burden on our colleagues, especially at country level. So this is maybe a trade-off we were fine to make. And finally, I wanted to show you another way we are using to present our results on specific aspects of our work. So we saw the narrative reports, the indicators, but here are some infographics that we are developing based on all the data that we're collecting, both narrative and the indicators. So here, for example, you have an infographic on HIV and young people. And as you can imagine, our reports can be quite long and dense. So these infographics allow us to highlight key information and are easier to digest for our readers. That's something that also other organizations can work on. And it would be nice also to contribute. We are trying to contribute as well with different parts of the organization to develop these infographics. And it takes a bit of time to consolidate the data and select which ones to display, but it helps you to frame the story as well that you want to share. So here, for instance, we wanted to show the different areas of support of the joint program in response to the needs of adolescents and youth. In the HIV response. And after the review of all the data, we identified these 9 colored blocks that you can see here, and we provided some key examples of the support of the joint program. So all of this can be, of course, summarized into less key areas of support or more detailed as needed. But this is just to give you an idea of how we are presenting our data, our performance data on young people. So that's it for me. Thank you.
Thank you so much for that, Marion. So we would like to invite all our panelists for the question and answers. To all our participants who is joining with us today, kindly use our question and answer function at the lower of your Zoom. So we'll wait if there is question coming from our participants. So while waiting, I'm just really interested to know any one of our expert can answer this, given now we are from White here and we are a network of youth-led and youth-serving organizations. Is there any tool that you can recommend specifically for those youth networks that are working on M&E, working on HIV program? What advice can you give? Anyone? How about Marian?
Thanks, Carl. So what advice can I give for organizations starting on M&E? Is that correct?
Yeah.
Okay, well, I would say that there are some very good tools available everywhere. There are a lot of trainings, there are a lot of things. So it's not the lack of information, it's not the lack of guidance that will avoid. I think it's important to, of course, get the right information, but also base ourselves on what works. We know, for example, that results-based management is something that tends to fall through the cracks sometimes when we just want to plan and report and do things as quick as possible. And of course, our teams on the field, they want to be more programmatic and make sure that all the work is gone into the program that they're implementing. But sometimes we forget that actually the importance of the planning based on the results-based management and then reporting following specific rules are actually helping as well the programming and the implementation of programs. So I would say this is an important component. And the second one, I would say that it will be about the sharing of information, the cross-sharing between organizations, especially organizations that have a similar structure or similar mandates. It can bring a lot to learn from others. Thanks.
Thank you so much for that, Marian. So for all our participants, you can use our question and answer or raise your hand. We will let you allow you to verbally ask your questions to anyone of our panelists. So yeah, I see Vicentius. Yes, over to you.
Yeah, thank you, Carl. I think when it comes to recommendation for fellow young youth-led organization, I would really recommend to start this logical framework, like the annual or fourth year to develop this logical framework, because when Inti Muda Indonesia already developed and has this logical framework, we be able to do to be more strategic when it comes to activities, when it comes to what are we going to achieve annually, what are we going to achieve in the next year. So for the youth lead organization, I think regarding I want to go back to like the CLM project in the Asia Pacific, the community led monitoring in Asia Pacific. It is currently progressing, but I think when we start to get our community, when we started to get our people, and also we start to have several projects, it is really important to go back to the people, to go back to community and develop this kind of framework to see whether the objective, whether the activities that the the national level wants to achieve is relevant for the province level, in the district level. So yeah, I think logical framework analysis and then go to the per activities is really important, and I will really recommend for your lead organization. Thank you.
Thank you so much for that, Vicentius. Yes, here we go. We have another question from our participant. Hi, I'm Kanak. I'm leading an M&E team of an organization working for HIV response among MSM and TG population in Kathmandu, Nepal. I haven't yet been able to link the learning aspect of MEL into my team. What suggestion would you give me to start? So anyone?
So I can
Yes, Dr.
probably
Over to you, Dr. Greg.
Yes, I can just go quickly. I would say the maybe my first recommendation would be to have an established learning agenda of some kind, which I think can be developed, collaboratively with the organization, and think about ways of articulating learning priorities and then rank them sort of by feasibility and what is sort of a high priority learning question or activity that one could undertake with limited resources. So it essentially would be something that answers a question that you all want to answer, but doesn't necessarily require a lot of resources. And that I found to be a helpful way of thinking about how to begin integrating learning. And I think more long-term, it could be a strategic process of either biannually or annually revisiting the learning agenda and resources to execute on that agenda.
Thank you for that, Dr. Greg. I saw Luis is raising his hand. Over to you, Luis. You are mute. We can hear
Sorry.
you. Sorry.
Sorry, yeah, that typical thing. So just elaborating on what Greg was mentioning before, and linking back to what I said when answering the question. So I think that this issue thrives on the M&E culture, and this is something definitely very difficult to change, and it's definitely not something that you changed in a blink of an eye. It takes time to make a team to believe on the virtues and benefits of MEL. Something that I've learned throughout my career is that most of the time, members of the team are reluctant to implement the learnings back into the program cycle, because they tend to think that it's a way of blaming or pointing out to failures of the program, which is far away from that. So I guess that what is important is to bring back the value of accountability and adaptive management. And again, that conversation takes time. It needs to be built on trust within your team, but to make sure that implementing learning doesn't mean to point out to failures, but to improving the program.
Yeah, thank you. Thank you for that, Luis. That's the most core value of M&E. That's how M&E works, and it is how important it is in every organization. So, do we have more questions? from our participants. We still have time. Feel free to raise your hand or write down your question in our Q&A function. So we have one question. Do you have any suggestion on how to create an impactful publication of the result of MNE? So any of our panelists would like to answer that question. Yes, Marian.
Thank you. Yeah, I think this is for me since I talked a lot about reports. So this is always the question, and every year we are trying to, of course, to improve our reporting. Either it's too long and it's not digest for readers, either it's too short and they are lacking information. So what we are doing is sometimes to divide the reports in different pieces to have something that will be very an overview, an overall a results report of whatever the organization is doing, or whatever the program, what are the results of the program or the specific projects, and then cut the rest of the reports in different pieces to have something more financial focused or something more about specific results that you want to highlight. Yeah, so this is what we are doing. So the 4 reports that I showed you are, for example, the executive summary, the higher level results. Then you have the reports per region. So this is quite interesting when you want to dive into one specific region. The results by organization, since I told you we are 11 UN organizations plus the secretariat, so we have one specific part of the report for each one of them, and the results report, which is by result area, so by thematic areas. So that's quite a lot, and we cannot put it all in one document. So by disaggregating it in several documents, it makes it easier. And then I would say the use of visuals, that's something that is always more attractive than long text. That can be that's a simple and effective way of making the reports more attractive to everyone. Thanks.
Yeah, thank you so much for that, Marian. Yeah, I do agree that when it comes to data, if there is so lengthy and too wordy, adolescent and young people might not be interested anymore to read it and to learn from it. So it's really helped with visualize on how they see the data using different tools or graph. Yeah, thank you for that, Marian. So maybe some of our experts panelists would like to add or to share or to answer that question as well. Or our participants still have questions, kindly raise our hand or use our Q&A function below.
Yeah, Carl, I think I want to add
Yes,
something.
Senchus.
Hi, Kanak. This is really interesting questions. I think the first thing that I want to share is let's connect. Let's connect to each other. I think I will be able to share some kind of material, tools, and insights regarding the starting the monitoring, evaluation, and learning process to your organization. Yeah, I think networking is really important to start this, and exchange learning. Thank you.
Thank you, Vicentius. So do we still have questions? So hearing none, and we're able to answer most of the questions. So for some of our participants that asking for the copy of slide presentations and the copy of the recordings, just keep posted through our Facebook page now for the promotion of this webinar. So there is question, I think. Last question before we end. So what's your role as UN AIDS in building the capacity of youth-led networks in HIV prevention? Maybe Marion directly to UN AIDS. Over to you.
Yes, thank you. And I'm really sorry, but I might not be able to answer the question properly since I'm absolutely not working in that area. I would advise you to go into the reports. That's where you can find most information. And yeah, I can, of course, give you the proper names of the people involved in building youth-led responses. Sorry about that.
Okay, thank you for that, Marion. So do we still have questions? Feel free to ask, use our Q&A function or raise your hand. So hearing none and seeing none. So thank you so much to Vicentius Asbian of Intimuda, Indonesia, Luis Garcia Espinal, Dr. Greg Grusen, and Marion Turk. So thank you so much for joining with us today, and also to all our participants coming from different countries, working in different ESRH field and HIV. Just keep posted for the upcoming activities and next date of our webinars. So with that, thank you so much and have a lovely day.
Thank you.
Bye.
Thanks, everyone. Bye bye.
Thank you so much.